Good morning, everybody, and welcome back. I hope you've had a welcome break and you've been able to move the legs a little bit. I would like to welcome you back to the first of our 4 panel sessions over the next 2 days. For those of you who weren't on the call earlier on, Gemma will be introducing the panel members. But before that, we've had some fantastic Twitter conversations going on, and I've been advised by the younger members of my team to suggest that people would like to join the Twitter conversation. The hashtag is hashtag what Florence means to me. So all the spoken presentations and the panel discussions are all, the 4 of them are centered around the 4 tracks that we chose many moons ago when we were part of the Nightingale 2020 steering group. So the first one now you're about to hear from is professional practice. Later on it's global health. Tomorrow it's impact, and the last one of tomorrow is digital health. So welcome back, everybody. Let me introduce you once again to Dr. Gemma Stacey. Gemma is the most amazing colleague of mine in our team, recently joined in January of this year, came from the University of Nottingham, a mental health nurse by background, and has done an incredible job. The foundation launched the Florence Nightingale Academy at the House of Lords in January of this year, and Gemma's been on board ever since, and we've really seen the foundation go from strength to strength. So I can see these lovely faces on the panel, and I want to thank you for, as I said earlier on, waking up early and staying up late, because we have members of this panel from both sides of the world. So thank you, and thank you, Gemma. I will hand over to you now.
Thank you so much, Greta, and it is my huge honour and pleasure to chair this panel discussion on professional practice. I'm going to ask my panellists to turn their cameras on and say hello to you all. I'm joined today by Liz Halcomb, Professor of Primary Healthcare at the University of Wollongong in Australia, Jessica Reid, who is the Chief Midwifery Officer at NHS England, and David Benton, who is the CEO of the National Council of State Boards in Nursing in the US, Andrea Sutcliffe, who is the Chief Executive and Registrar of the Nursing and Midwifery Council UK, and finally Lisa Collinson, who is Programmes Manager of Nursing in Primary Healthcare for the Australian Primary Healthcare Nurses Association. So as you can see, I'm joined by some really prominent and influential leaders who have all had significant impact on the world of professional practice for many, many years at a national and for some global level. And as an introduction to this panel discussion, I'll let you into a little bit of the background story. So when I met with the panellists prior to the session, Jess said to me, "But gosh, Gemma, this is such a wide area. The potential of where we could go with this is vast. Should we have a particular focus for this discussion?" And my reply to them was that the focus should be their individual points of view. And that's their individual perspectives coming from their particular position, their viewpoint. And I gave no further instruction than that. And for me, as a mental health nurse, as Greta said, as a woman, and also as a social scientist, my agenda behind this is to give you, as our audience, the opportunity to really explore and understand that standpoint, that position of these very significant and influential leaders. Now, that standpoint, that perspective will be influenced by the cultural context, the gender, ethnicity, the political climate of the country within which they work, but also the hundreds of individual interactions, experiences that they have within their roles and also within their personal life that shapes this very unique personal point of view on this particular issue of professional practice. So as our audience, I would really encourage you to sit back and enjoy what we hope will be a really engaging and thought-provoking discussion around the issues of professional practice. And we'd like you to join us in contributing to this by talking to us through the chat box, using the Q&A function. All of our panelists will stay online after the session and respond to your questions, and also to join in the conversation via Twitter as well, where all of our team are ready then to respond to you there. So my first invitation for you to listen to the point of view and perspective is Liz. And I would like to invite Liz, I think you want to share your screen with us, don't you?
Thank you very much for the invitation to present to you guys tonight, or this morning, wherever you are in the world. And I guess when Gemma asked me to speak in this session, I really had to think long and hard about what it was I wanted to speak about. And in the 5 minutes I've got to speak to you today, I really wanted to talk about something that's going to challenge us all to think about something that we could all do as individuals today that could really impact on the professional practice of the nursing profession. And I guess that this bottom-up approach is a really important way to dovetail with some of the higher level leadership and policy initiatives that are happening in nursing across the globe at the moment. And I want to start by asking a simple question. When someone asks you what your job is, what is it that you tell them you do? Most of us will say that we're a nurse, but do we say any more? How many times have we heard a colleague say, "I'm just a nurse"? A few years ago, I had the pleasure to lead a professional practice standards development for nurses working in general practice. And as part of this work, I conducted a series of focus groups across Australia, speaking to hundreds of nurses about what it is that they do every day. And when I asked them what it was that they did, often they made comments like, "I help the doctor," "I make sure everything's ready for the patients," or "I run a clinic." While all of these things are part of what a nurse does in their daily practice, they really skim the surface of what a nurse actually does on a day-to-day basis. And there were a number of things that I didn't hear from any of these nurses. I didn't hear anyone speaking about being educated or regulated health professionals in their own right. Many of the nurses spoke about the role they played in supporting patients, like helping people to understand their medications or encouraging people with diabetes to change their diet, but they really didn't capture the impact that nurses have on people and on the people who they're providing care for. And finally, very few of the nurses I spoke to talked about nursing leadership and the role of nurse leaders within the healthcare system. So why is this important? Having the nursing workforce visible and valued is essential to our profession. It's essential to the healthcare system and those requiring care. As the nature of healthcare and health systems is evolving, it's important that the nursing profession stays relevant and maintains its scope of practice. If we as nurses don't take control of the narrative and communicate about the value of our profession, others will. COVID-19 has really highlighted the importance of nurses being visible and valued within the healthcare system. When COVID first emerged in Australia, our research team was really shocked to see that nurses who were working outside the acute care system were losing their jobs. In a rapid survey we conducted, nearly half of the respondents reported either having their hours decreased or losing their jobs and employment. Now, this situation occurred as the funding models within our health system and the primary healthcare organisations were insufficiently agile to adapt the remuneration to fund these nursing positions. With fewer nurses in our community health service, delivery was disrupted and the most vulnerable people were exposed to poorer health outcomes. While clearly health policymakers and bureaucrats were overwhelmed with such a unique and serious health crisis, the value of nurses was lost in the maze of rapid policy making. The very professional group who, by virtue of its size, had the potential to effectively be mobilised to support healthcare delivery was actually somewhat forgotten. And the only exception to this was the upskilling of nurses to work in critical care and reaching out to retired nurses to bring them back into the nursing workforce. And it's really taken some time for the value of nurses in the community to be acknowledged and strategies implemented to maintain and strengthen the community-based nursing services in our society. And I would argue, though, that nursing is still very much positioned as a second-class role, and the role is truly not valued and visible at a policy level. To give you an example of this, take the media coverage around COVID. For many weeks, our Chief Medical Officer and Deputy Chief Medical Officer have been appearing on national television, radio, and in the print media. These individuals have been seen to be driving the political decision-making around the pandemic precautions and practices. In contrast, the Chief Nursing Officer has been cast very differently. In several videos, she's shown people how to wear masks in aged care or PPE. And it's only been much more recently and very infrequently that she's been appeared in the media to provide COVID updates. Now, this is not a comment about any of these individuals who've done an amazing job in extraordinarily difficult times. The comment is simply made to illustrate how nurses are positioned in comparison to their medical colleagues. Now, the other outcome from COVID has been the positioning of nurses as being angels and heroes. And this depiction often appears to be intended to express gratitude for the selfless work that nurses are doing. Now, while the sentiment of this can be very much appreciated by those working tirelessly on the front line, when we look deeper, this depiction has some quite unintended consequences. The key features of a hero are integrity, bravery, self-sacrifice, while the angel is characterised as being caring, comforting, and a female servant of God. While nurses should certainly possess compassion, integrity, and competence, should nurses be brave, self-sacrificing, and divine? The image of nurses also seems to infer that their skills and knowledge are somehow imparted to them rather than being the result of education and professional development. This is somewhat like suggesting that an Olympic athlete is just talented and failing to recognise the fact that they spend many hours of training to develop their craft. This 2020 International Year of the Nurse and Midwife was destined to be a year where the value of nursing and midwifery was showcased to the world. And while none of us could have imagined the impact that COVID would have had on us, it's timely for nurses to take control of their professional narrative. Each and every nurse needs to consider the way in which they represent the profession to others. We all need to have an elevator pitch to describe what we do in our work and the contribution that nurses and nursing makes to the community. Such a narrative needs to highlight that nursing is a profession in its own right, and the skill and knowledge and education of nurses extends beyond the personal characteristics of compassion and integrity. Nurses are critical thinkers, compassionate patient advocates, empathetic communicators, strong leaders, strategic managers, innovative researchers, skilled educators, and dexterous practitioners. They are never just nurses or angels or heroes.
Thank you so much, Liz. My goodness, I just saw Andrea doing a round of applause there, and that's the absolute reaction that I want to give you. If we were in a room together now, we would be doing exactly that. So thought-provoking. Thank you, Liz. So our next panellist is Jess, and Jess is similarly going to share 5 minutes of her thoughts around the salient issues relating to professional practice from her perspective as a midwife and a national leader.
Great. Well, thank you. And thank you to Florence Nightingale Foundation for inviting me to share my thoughts about professional practice. And I decided when I was reflecting on Gemma's response, when I said, this is such a massive area, what would I like to highlight to this audience and to all of you who've joined? And my sense is that what we've needed more than anything, most recently, but yeah, particularly most recently, is compassionate leadership. And so I'd like to just reflect on a few thoughts about compassionate leadership in enabling professional practice. So just to take you back, again, when I was thinking about what I would say to you all, I took myself back to when I first trained. I'm a nurse and a midwife, and I looked at my first training notes back in mid-80s, I have to say. That's a giveaway to you all, about my midwifery notes. And I just want to read out this quote that was written at the very first page of my midwifery training notes. A midwife must constantly put out effort to stay compassionate, open and clear in her vision, for love and compassion are two of the most important tools of her trade. And I just thought I really liked that. I saw that and I thought, my goodness, that says so much. And I don't think I had any idea at the time how relevant that was and is always to us in our profession, but particularly in recent months. So we know that professional practice refers to the conduct and work of someone from a particular profession. And professions are underpinned by standards, and we are grateful for the education, the regulation and the practice opportunities that we have in this country for nursing and midwifery, the nursing and midwifery professions. We have the Future Nurse and Future Midwife standards that have recently come out. The NMC work tirelessly at keeping our code and our regulatory tools and resources up to date and up to speed, and are currently looking at reviewing them. We're really fortunate that nurses and midwives make up the largest proportion of the health and care workforce in England. And we're fortunate because that gives us a voice, a strong voice, from where we can platform all of the important elements of our profession and make sure that we are constantly valued, and that policy reflects that. And I'd also like to draw attention to the context that we are working through today, this global pandemic. And unlike anything we have had to face before for nurses and for midwives, we've had to consider how to ensure that nursing and midwifery is enabled to flourish and to thrive at a time when staff, nurses and midwives have been taken to the extremes of exhaustion, the extremes of giving out and empathizing and providing that compassion to others. And the need for us as leaders in each organisation that we represent, whether it is education, research, practice, regulation, it is so important that we underpin everything we do with kindness and compassion, so that we can enable professional practice. And I've been very helped by a document that came out from the King's Fund, a report's come out from the King's Fund recently called The Courage of Compassion, Supporting Nurses and Midwives to Deliver High Quality Care. They've come out with 8 strong recommendations and give us all a call to action. And this is about every single one of us in the audience today. And what is the impact of the pandemic on the nursing and midwifery workforce? It cannot be understated what impact this has had on the nurses and midwives we work with, and the fact that it will remain with us into the future. And we all have a responsibility in ensuring a legacy that we can learn from all of the things that have been embedded that have been good and positive. And we can also do all we can to ensure that should this happen again, we are ready and able and have an enabled workforce to be able to handle and to continue to handle as we go through wave 2. The challenges we were facing as professions prior to the pandemic have been exacerbated, including chronic work pressures, inadequate working conditions, and inequalities. And there are 3 principles that I'd just like to leave you with that I would like to see all of us taking forward. The first one is the principle of sustaining just, fair, and psychologically safe cultures. All of us have a role to play in that. The second one is to lead compassionately, listening to staff and colleagues, and supporting everyone, all of us, to deliver high quality, safe care through strong education, fair and responsive regulation, and compassionate leadership. And third, for us all to tackle the chronic excessive work demands and to proactively address and prioritise the health and well-being of staff. One thing that we can all do is to listen attentively to those around us, those we work with, our colleagues, remaining proximate with the nurses and midwives who are delivering care in the most extreme circumstances, demonstrating and role modelling kindness and compassion. And by doing that, we can move forward together and shape our future as we see it needs to be shaped. So now more than ever, let's pull together. Let's demonstrate compassionate leadership so that we can support our professions to flourish and to thrive. Thank you.
Thank you, Jess. Amazing. And again, we would be doing some whoops in the audience, I think, to that message if we were all in one place together. So powerful. And it's wonderful for me to hear you speak, Jess, because I know working alongside you to facilitate our Nightingale Frontline service that you embody everything that you've just described there, a true role model of compassionate leadership. And I really do value your words and the messages. Okay, thank you. And we're moving on now to David. And David, I do believe you've got some slides for us to share. So I'll ask the team to set those up for you, and brilliant, that's working well.
That's great, thank you very much. If we could just move to the first slide. I've been involved in regulation for almost 40 years. And as a result of that, I've been meeting with regulators from around the world. And it's from that perspective I'm going to share this presentation. When I ask regulators what it is that they do, they more often than not, they say, well, we're there to protect the public. But I actually argue that regulators do much more. Regulators save lives, and they save lives through very specific ways. They set education, practice, and conduct standards, which means that the quality of care that we all receive when we are the recipient of that care is of the highest possible standard. So regulators have a much expansive role, which often isn't communicated widely. But the regulatory model that we are currently facing was developed over 100 years ago. It was developed in the industrial era. And as a result, we actually need to think about how we recast that model and how we as nurses, whether we be in practice, education, research, service delivery, in the community and hospital, are involved in that process. Because we are now living in a complex, dynamic digital age. We are no longer the case where we were born, educated, worked, and died in the same small community. We are now global citizens, and care is delivered across international borders quite regularly. The model also needs to move away from simply looking for bad apples and dealing with them when they occur. We need to think about how we shift the curve of everyone's practice. And that means that we need to have a much more dynamic interaction with registrants in a way that actually helps them keep on track and keep prepared for what's coming over the horizon. In the past, we often saw ourselves as individuals working as part of nursing teams. Increasingly, it is a multidisciplinary team that epitomizes excellent care, both in community and hospital settings. Yet our regulatory model still works in an isolated way. Nurses are addressed by the nurse regulator, doctors by the medical regulator, etc., etc. Therefore, one of the challenges we need to face is to think about how we reform the regulatory model in a way that encompasses team-based services. In the past, much of our education was focused around the hospital and in terms of treatment. And since the 1980s, we've started to see more of attention on the issue of prevention, and that will accelerate. If you look at global demographics, many countries are having fewer children. The success of their health systems mean that people are living to an older age, and those elders often have complex and multiple pathologies that actually need treatment. But those could be prevented if we were actually intervening much earlier. Therefore, the move from a treatment to prevention model and how we actually educate and regulate within that context is something that we need to address. Historically, we looked at single events. When a complaint came in to the regulator, the focus, rightly, was around what was going on with that individual at that moment in time. But increasingly, and as we move into the future, we need to look at a continuous assessment model. Regulators need to work with employers to actually identify when people are starting to drift off the path and intervene at an earlier stage so that we can avoid a complaint and actually provide excellence in service. To do that, we need to move from a manual system to a system that is supported by artificial intelligence and the use of data and technologies. And I'm privileged to work for an organization that has been able to bring together data on all of the nurses in the United States. We have data that is updated on a daily basis in relation to their status from the regulator. It's uploaded every midnight, and therefore we have a live register that is completely searchable by the public and by the regulators themselves. So to address that, NCSBN has undertaken a number of pieces. And I would just draw your attention to these. These are all available as free downloads from the Journal of Nursing Regulation website. Regulation 2030, First Steps in a Journey, analyses the global literature on regulation, not just nursing, but from around the world and from other disciplines, and identifies 25 major trends that we need to address. Acting in the public interest captures messages that we can use to really explain what it is that regulators do and how we act in the public interest, saving lives, advancing the profession. The final document, a global profile, is based on an analysis of the regulatory domains from around the world. We gathered information from 320 jurisdictions from around the world, and that is also available as a searchable database on the regulatoryatlas.com website. These are all essential pieces of information that we need to reform regulation. By reforming regulation, we will be fit for the future. We need to work together as educators, as regulators, as service delivery experts, and actually influence a global agenda where today's regulatory model is fit for that complex digital age. Thank you very much.
Wonderful. Thank you so much, David. And such a contemporary account of how regulators are modernising their approach and really driving professional standards forward as opposed to reacting to issues where professional standards have been breached. Hugely valuable to us. And thank you so much, David. Now, very complimentary to this, we now are going to hear from Andrea, who is Andrea's equivalent, I would say, on a UK basis. The NMC, the CEO of the NMC, which is my regulator. And Andrea, I'm so pleased to welcome you today. And thank you so much for your time. I'll hand over the microphone to you.
Thank you very much, Gemma. Well, as Liz has already said to us, when the public think about nurses and midwives, they often say, she was an angel, he was a hero. And that may be lovely to hear, but it doesn't tell the full story. Nurses and midwives are professionals. They have the behaviours, the knowledge and the expert skills required to provide kind, safe, effective, person-centred care that supports people, their families and their carers and improves everyone's health and well-being. As professionals, nurses and midwives have a personal responsibility to be professional by keeping their skills up to date and following their code of practice. But it's a tough job working in challenging circumstances and never more so than in the middle of a global pandemic. And that's where regulators come in. We're enablers of professional practice. In the UK, in April, we set out the strategy for the Nursing Midwifery Council to take us from 2020 through to 2025. And we're clear, our purpose is to promote and uphold high professional standards in nursing and midwifery, protecting the public and inspiring public confidence. And we set out 3 ways to do that. We regulate in the public interest, giving people confidence in our professions. Our regulatory role is delivered better when we support the public, our professions and our partners. And if we regulate effectively and support people successfully, we can share our insight to positively influence the context for learning and care. When we were developing the strategy, we didn't expect it to be stress tested in quite the way it has been over the last 6 months, but it stood that test, and regulate, support, influence has guided us and, I hope, helped our professions tackle the biggest crisis I've ever encountered in my 56 years on the planet. Regulation is our first and foremost responsibility. We don't get to do anything else unless we regulate well. That's our ambition. And key to that is setting the standards of proficiency and behaviour we expect from our professionals when they join and stay on the register. Using those standards to guide regular revalidation gives our professionals the confidence they need in themselves and in each other to cope with some of the extraordinary things they have to do in practice. And during the pandemic, we've needed our nursing and midwifery professionals like never before. Our task was to make sure we increased the numbers of people who were safe to join the register and support that emergency response. We established a temporary register and the response was amazing. Over 14,000 people answered the call. And we've worked hard to maintain the professional standards we've set, which meant, for example, agreeing conditions of practice for some returners. And we also tried to sustain as much of our regulatory activity as we possibly could, so we could keep on registering new professionals and responding to concerns raised. But we were also very mindful of the pressures colleagues were facing. Our regulatory role has always been there, but we want to transform the way we do it to really support our professionals to practice the best they possibly can. And there's all sorts of ways we can do that, and our values of fairness and kindness underpin our new ways of working. So during the pandemic, we're focusing on providing clear information for the nursing and midwifery professionals on our register through our coronavirus hub, what we're doing, why, and answering questions we know our professionals had. We also want to create resources that are useful throughout people's careers, helping them to deliver our professional standards and address future challenges. So recently, we've created our Caring with Confidence campaign, a series of bite-sized animations about key aspects of nursing or midwifery professional roles and how the code can support them. Topics have included accountability, professional judgment. And I know I'm biased, but I think they're brilliant. So please take a look. If we regulate effectively and support professionals successfully, we get to influence. Being a nursing or a midwifery professional is tough, and we have a responsibility to collaborate with others to create the conditions where our professionals can flourish and thrive and make a real difference. We want to use our insight and voice to highlight key issues, argue for change where appropriate, and amplify the role of nursing and midwifery professionals with the public and other stakeholders. So during the pandemic, we've spoken about key issues like the disproportionate impact of COVID-19 on nurses and midwives from Black and Asian and other minority ethnic backgrounds. There's more we can do, but we're confident our focus on regulate, support, and influence will help to support and strengthen the professionalism of everyone on our register. Thank you.
Wonderful. Thank you so much, Andrea. Big round of applause from us. And you know, it's so interesting to hear how your language is changing around how you're describing the work of the NMC. And I think that that's one of the really key aspects that joins yours and David's agenda together, that this is about how the profession regards its regulators and communicates and interacts with its regulatory body, and seeing that as a support and a place to go to build confidence. So that's wonderful. Music to my ears. Thank you so much. Now our last presenter is Lisa, so I'm going to hand over to you now, Lisa.
Thanks so much, Gemma. I'd like to start by acknowledging the traditional owners on the lands on which I'm meeting with you today and pay my respects to their elders past, present and emerging. So I understand that you would all be fully aware of the challenges that are facing the health system globally, and with increasing rates of chronic conditions, ageing populations, rising patient expectations of us as nurses, and now the impacts of COVID. And there are so many professional practice issues, including many mentioned by the previous speakers, and including one of our key issues in developing and enabling the optimisation of our nursing workforce to work to full scope of practice unhindered. So for today, I'd like to put a spotlight on one key aspect which impacts the sustainability of integrated nursing models, and that is the funding barriers. Because even if nurses overcome the other barriers to working to their full scope of practice, and let's face it, there are many of them, the funding model can crush it, particularly if you throw a pandemic into the mix. And as Liz mentioned earlier, you know, nurses in primary healthcare in Australia were losing hours. They were being made redundant because people were afraid to come into the clinics. We were also doing pulse checks regularly on that. Many different models of care involving nurses and midwives have been implemented across the world. Nurse clinics or nurse-led clinics, for example, exist in a multitude of healthcare settings and across multiple jurisdictions, both here in Australia and internationally. It's been established that nurse clinics result in improved health outcomes, increased access to health advice and treatment, shortened waiting times for patients, and decreased rates of hospital admissions. And they are funded in a variety of ways dependent on the healthcare funding system and the country of origin. Today, I want to link the work we have done here in the primary healthcare sector in Australia and the learnings gained through the implementation of 40 nurse clinics within primary healthcare services, utilising a nurse-delivered team-based model of care approach. And when I refer to primary healthcare, I'm talking about multiple settings that sit outside of the acute or the hospital sector. Our measurement of success for our nurse clinics has been based on several measures, including sustainability, feasibility, acceptability, effectiveness, efficiency, replication, and of course, the perception of value. The focus of today sits with the sustainability aspect and includes in financial viability, because one of the biggest obstacles to improving workforce planning and modernising care provision to meet changing needs is the fragmentation of control and funding across the healthcare system. So no matter where in the world you are located today, and whether or not you work in the acute hospital setting or outside of this in primary healthcare, the funding mechanisms for integrated nurse models of care directly impacts you, whether that be positively or negatively. Broadly speaking, how it works in Australia is that the federal government funds the primary healthcare system, while the 8 state and territory governments predominantly fund the hospital systems, although occasionally they do fund some primary healthcare nursing services in prisons, schools and community health services. Well, that doesn't always work so well for 2 sectors that need to work together in the interest of person-centred care. The funding streams here in Australia can be hard to follow as they are separate. And just to make it even more complicated, they are made up of block funding, bundled payments, fee for service, also known as MBS or a Medicare benefit schedule, private billing, mixed billing, co-payments, or a blend or a combination of a number of these. So what we know from our financial viability work is that primary healthcare nursing models, such as nurse clinics, that operate under block or blended funding are more likely to be sustainable and more likely to be viable than those that rely upon fee-for-service funding alone. Well, I guess that's good news for countries who do operate under this type of funding arrangement. It's also good news for some settings in Australia, such as community health, correctional health and hospital services. But it's not such good news for the many nurses who work within general practices in Australia, where there is no single definitive funding source for nursing services. They are employed in predominantly small businesses who use the fee-for-service MBS funding, which, by the way, is mainly based on the GP activity and does not remunerate or recognise the full contribution of the nurse, and where there is block funding available to general practices who meet certain criteria, there is not a robust system of accountability. And so it goes into the big black hole of general revenue, and the nurse is not supported to work to their scope of practice. So in closing, despite the non-enablers to a more sustainable system, we are still, unfortunately, just talking about the change needed rather than making the change. And this is often due to the funding model, which constricts rather than optimises the primary healthcare nursing workforce, and in fact, the whole nursing workforce in Australia. Thanks all.
Thank you, Lisa. Such an important message there, and again, real gratitude from the rest of the panel for the important content of what you shared and the context of how nursing models are funded within Australia. I think it's so key to listen to that message around how do we demonstrate the value of our contribution and ensure by using our platforms of authority to really campaign and advocate for proper funding to follow and enable the impact of our nursing intervention. Thank you so much, Lisa. Now we have some questions for our panel, and my first question is related to the Nursing Now campaign and more locally our Chief Nursing Officer in England's campaign around a discourse that is about unifying the professional voice of nursing. So those of you that are familiar with the Chief Nursing Officer's campaign in England, this is the hashtag One Professional Voice, and that's a message that's been reiterated through the Nursing Now campaign. And I'm interested to hear from our panelists around how we can embed and sustain that approach moving forward. Once these campaigns come to an end and the media attention moves away onto other things, how do we continue this idea around the one professional voice? And I'm going to put that question to Jess first of all.
Thank you, Gemma. Yes, I think it's such an important campaign and a really helpful and interesting and challenging question. How do you maintain focus once the campaign has come to an end? And I think that will be the evaluation of the effectiveness of the campaign, to be honest. I don't think a campaign should ever be just about, that particular small time. It has to be the effectiveness of it will demonstrate that it is embedded in how we practice and how we move forward on things. So yes, I mean, the one professional voice, as you said, is a key ambition for our Chief Nursing Officer. I've been really excited to see how that is beginning to get embedded into what we're doing day in, day out. One of those things is the development of shared professional decision-making councils, and it's been a real pleasure to be part of the midwifery, the National Midwifery Shared Professional Decision-Making Council, where we have been listening to, and as I mentioned earlier, the importance of attending to and listening to midwives as from clinical, the clinical rock face, let's say, and what matters to them, what's important to them as we look at designing our services, as we look at making sure that we are delivering high-end quality care to women and their families. What's most important to the midwives and the nurses who are at the clinical front line? And that's been really valuable. The raising the voice of the profession, I think, is so very important for nurses and for midwives, and for it to come across as one voice. So I think embedding it going forward, making sure it continues once the campaign is over, is about involving the people for whom it matters the most. So involve your nurses, your midwives at all levels in ensuring that we are speaking with one professional voice. You're so much stronger. We're so much stronger when we're speaking together and working closely with our allies, with our regulators, with providers up and down the country, with education institutes, with our researchers, demonstrating that the themes that we are all working towards are the same, so that there is consistency in all that we're doing. So if we can do that now, hopefully we'll be able to maintain that focus going forward.
Thank you, Jess. And Lisa, would you have anything to add to that from the Australian perspective?
Oh, I love you, Jess. I don't know you well enough to say that, but I'm saying it internationally. Look, I think it'd be wonderful to see a global unified professional voice gain momentum, because each country struggles with similar issues relating to the nursing profession. We hear all the time, over and over again, the themes come out around the need to increase the understanding of scope of practice, raise the profile of nursing, change the perception of the value of the nursing profession. And look, the Global Nursing Now, the Nightingale Challenge, and the UK program or campaign at the moment all sounds amazing. And APNA actually has a Nurse 2022 campaign that is valued, visible and respected. And that involves asking primary healthcare nurses to make a pledge and take action to promote their role, support their profession and colleagues, and take charge of their career. They take the pledge, and then the thing that we're struggling with is keeping that momentum going. So I was really actually hoping to hear, come on guys, tell me how to do it, because we acknowledge that it's really, that embedding is so important. And we've decided that, you know, we're just going to keep changing the date on our valued, visible and respected, because we can just keep changing it to different years. But what I think, I agree with what you're saying, Jess, you know, we need to, and Gemma, we need to embed it in the profession, and, you know, through nursing leadership, through all of our preceptoring and mentoring programs that we run. Every country runs these amazing programs. Love the regulators. APRA here in Australia do an amazing job. You know, and I think if I think about how would we tackle this at its core, you know, in undergrad programs, we would empower nurses early, I think, to, you know, to stand up, to be seen, and to have that voice, and to be unified. I'm not sure how I'd measure success. I've thought about it all day, and I can't really come up with some solid measures, but given that we're just embarking on this conversation, I think it would take each country taking ownership of the process, adapting their different nursing. For example, in Australia, we have CNO. It stands for the Coalition of National Nursing and Midwifery Organisations. There's 58 national nursing and midwifery organisations in Australia, would you believe? But they work collectively to advance the profession. We have a regulatory body as well, but wouldn't it be lovely if we did have an international group that could connect with all of our countries to just keep this going? Because as you said before, you know, we are one, but we are many, and, you know, we have one voice, but we can shout really loudly if we shout together. So that's all.
Thank you, Lisa. Wonderful. And interestingly, our panel on global health, which we will hear from this afternoon, will pick up some of those points that you identified there, Lisa, and thinking about how we do continue this on an international level. So my next question is really building on David and Andrea's presentation about how the modernisation of regulation is starting to influence how the relationships are forged between the regulator, the educator, the employer, and also the government. I wonder, David, if you could start off with explaining to us more about that point that you made within your presentation and just elaborating on it for us.
Sure. And I mean, one of the things I would say is that if we can work together and have a shared vision, along the way to attaining that vision, each of the different sectors will actually benefit from this. We may benefit in different ways, but we actually end up in the same place. One of the things I think we need to be much smarter at is not nurses talking to themselves or nurses talking to nurses and midwives, but nurses actually talking to the real decision makers and looking to see how we can help them deliver their agendas and, as a byproduct, advance the nursing role, the nursing and midwifery role. I'm a great believer that chief executives, and I'm one of them, chief executives, members of the government are always looking for solutions. They're not looking for problems. So we have got to pay attention to the agenda that is driving some of their debates and position our contributions in the heart of that agenda. Not just say, aren't we doing a great job? It's actually about, this is how we can help you deliver your agenda. So I think that is one of the things that we need to do. Earlier this year, the World Health Organization launched the State of the World Nursing Report. One of the recommendations in that report is collaboration. And that's collaboration both within the professions, across professions, and outside of the health sector. Because remember, we're actually looking at an agenda now of the Sustainable Development Goals, which means that the environment that we live in has as much of an impact on our health and well-being as the services we offer in our primary and community care settings. So all of this together means that we have to work in a much more coordinated way. We're no longer soloists, but we are actually part of an orchestra that together will actually deliver a much better service for the citizens of the world.
Fantastic. What an amazing analogy. I love that. And Liz, I wonder if you might add to David's response or your perspective.
Yeah, I think it's been really exciting listening to David and Andrea speak about the sort of regulation things that are happening in the UK, because I think that from the sound of it, it sounds like they're doing a much better job in the UK than we probably are in Australia at the moment. And I guess some of that comes from the fact in Australia, I think we sort of had a big change in our regulation program sort of 10 years ago now. And realistically, at the moment, we're still operating as quite a number of separate entities. And I think that the gaps between the regulators, educators, employers and government are actually still quite wide. And it's an area that really seems to be much more advanced in the UK. In 2019, we had a national review of nursing education. And I guess that was kind of seen as a bit of an impetus to perhaps moving some of these things forward. Unfortunately, with COVID happening in 2020, I think the moves that might have been stemming from that review of nursing education have stalled somewhat. But I really like David's comment just then around the fact that it's really important, I guess, for nurses to be making sure that we are talking to not just to ourselves, but to other sectors, and it really showcasing what it is that we can do to solve the problems rather than what our problems are, I think is a really key point for us all to remember as we move forward.
Thank you, Liz. And just to clarify, although you would be fooled by David's accent, actually David's here joining us from the US today. So he represents the US, but there is huge commonality, I think, from the perspectives that David and Andrea have given us. So thank you, Liz. And Andrea, from your perspective, anything you would like to add or respond to David and Liz?
Yes, thank you ever so much, Gemma. And Liz, just to give you reassurance, we're on a journey. I wouldn't by any stretch of the imagination suggest that we've got it cracked. Because I think that what we've been doing is moving from a reductive view of regulation, you keep the register and take people off when there's a problem, but to a much more inclusive and developmental and positive view of regulation. And one of the things that I think that does is that we're potentially going to get involved in things that people might think is actually their territory. That we're encroaching on the things that they might be wanting to do, and that educators, employers, and others. So as I think David has already said, the key to that is collaboration, working together, having a shared common agenda. David said vision, absolutely agree with that. But a shared vision that recognises that a just no blame culture will improve safety and will improve care, and that we are part of the solution, not part of the problem. And so working together in that way. And I do think, just to add to the point that David was making about the way that we talk to policymakers, we need to explain better what we do and how we do it. And that's important for government, and it's also important for the public, because I think that we've also got to get away from the view that regulation is about punishment, but actually it's really about improvement. And that's something that we have to influence across the board with the government, with public, and with others.
Fabulous. Thank you, Andrea. So we've got a few minutes left together now, and I just wonder if I could ask the whole panel just for their reflections really on how professional practice has been most impacted recently by the pandemic. Just a few words, a few sentences from each of your viewpoints. Lisa, may I ask you to offer that first of all, please?
Oh, sorry, Gemma, couldn't find the button. I guess I want to look on the positives of COVID, even though there have been some impacts to nurses in the primary healthcare sector. I think what we have found is that communities have pulled together during this and recognising more that the value of the nurses. We've had nurses get out in shipping containers to run their immunisation programs, run their cervical screening programs and things like that. So I guess professional practice, whilst in some ways it's been diminished and their scope of practice hasn't been able to be utilised well, in other ways we feel like the community has embraced some of the changes.
Fabulous, thank you. And David, your thoughts?
Sorry, problem finding my unmute. I think there's kind of three words that I would use. I've seen incredible innovation in the education space, in the service delivery space, in the regulatory space. And nursing has been at the forefront of that. And they've been generous in sharing that with other disciplines as well. And as part of that, I think what we've seen is a pooling of resources as part of that.
Fabulous.
I think clinically, they've been incredibly agile. From a very personal experience, I know that my mother-in-law, not through COVID, but she passed away recently, and us being in Chicago on the other side of the Atlantic, it was nurses actually found solutions to enable us to connect, to be with her, and to really make her final days a pleasurable experience for Denise's mother. So I think the agility that they've demonstrated has been phenomenal. And in the middle of all of this, nurses have continued to see the holistic nature of the needs of the client, whether it be the individual, family, or the community. They haven't just focused in on COVID-19. They've actually focused on what it means to receive a service that makes a difference between life and death.
Thank you. Thank you so much, David. And Jess, your thoughts?
Thank you, Gemma. I would just like to air back to what I said earlier about having been part of the fantastic Nightingale frontline sessions, and hearing what midwives and nurses have been going through and their experiences of that. The one thing that they have all valued above anything else is kindness and compassion. So, being kind doesn't cost anything, does it? And it's so relevant whether you are with your colleagues at work, wherever you work, whether you're in a service and you're looking after patients or women and their families. Being kind has been valued so much, and that's what I've learned. I think it, as I said, it doesn't cost anything, and yet it's so important. So the innovations that David spoke about, what services have put in place, like trolley runs with coffees and teas to enable staff to have breaks, have been incredible. Going the extra mile, being able to rethink about flexible work shifts and things like that within services to accommodate the challenges that staff are facing. I mean, they go on and on and on, and and that's what I'd just like to finish with. I think the importance of kindness.
Thank you so much, Jess. And Liz, your thoughts?
Wow, everyone's kind of commented on a lot of the things I was thinking of, but I guess there's three things that really struck me. The first one was around, I'm an academic, I work in an institution that has an undergraduate program, and the ability of our nurse educators to pivot that program to be a fully online program within a space of 2 weeks never ceases to amaze me. And I know a number of my academic colleagues from across Australia and from across the globe are facing unemployment and some major issues like that at the moment. So I think that the ability for them in those trying times to be able to pivot those programs to maintain our nurses and our throughput of undergraduate nurses has been really inspiring. Secondly, I think that one of the things I've noticed from the primary and community healthcare nurses that we've talked to during the pandemic is the way that they've been able to connect with people and try and really identify those health needs that they would normally be meeting out in the community that are going perhaps underserviced at the moment because of the changes to the service delivery. And those nurses have really tried to come up with some innovative solutions to try and address those needs sort of for people beyond COVID. And I guess finally, I think one of the big things, particularly for community and primary care nurses, is the realisation in Australia that their role really needs to be, I guess, sold more clearly to policymakers and to funders, because at the moment, the lack of funding as a result of the changes due to COVID, of people not not going to clinics and those type of things has really impacted on the nurses' ability to do their role. So really, I guess it's showcased the importance of nurses taking an active role in moving their verbalisation of what it is they do and bringing that into policy.
Brilliant. Thank you so much, Liz. And finally, Andrea.
Thank you very much, Gemma. And I'm going to pinch a couple of words that Liz used in her presentation about nurses and midwives being visible and valued. And I think that's really what has happened during the pandemic. You know, the breadth of the nursing and midwifery roles, and in particular, a very close interest of mine, you know, what people are doing in the community, in social care, for mental health and all sorts of other things. And also the sacrifices that people have made. They have been there when the family hasn't been there. They have, you know, actually abandoned their own families and moved into their services so that they could continue to provide that care. And the innovation that others have spoken about already has all been there. It has been visible. It has been valued. But what I would also say is that I think that we have to be really mindful about the impact of that on the mental health and well-being of our nurses and our midwives, and in England, our nursing associates. And we have to really think about making sure that we care for those who have cared for us during this period of time.
Wonderful. Thank you so much, Andrea, and thank you to all of our panellists. When we started out the session, I invited you as our audience to listen to the perspectives and the points of views of these very influential and significant leaders in their fields. And I guess when we started, we said that they all have their own standpoint, they all have their own perspective, but because of their roles, their perspective, their points of view has authority and it has influence. And I hope what you've heard today has given you faith that they are using that influence and authority to really forward and modernise and drive the agenda forward on behalf of our profession. So thank you everybody for the important messages that you've shared with us today. And I've seen that there's lots of questions in the Q&A, so please do stay online and answer those for our audience. And also to those of you in our audience, please do take some time to reflect on your particular standpoint, your point of view, what shaped your reaction to what you've heard today, and how can you use your sphere of influence to really take on board these messages and make the difference in the areas that you work within. Thank you so much.
Gemma and the panel, thank you so much. That was absolutely riveting. I really enjoyed every second. Thank you for your time, everybody from different parts of the world, getting up early, staying up late, and our UK, our colleagues. Thank you. That was really first class. So a great act to follow. So thank you. I think that there are a number of questions in the Q&A box, so the panelists are going to stay and answer some of those. For the rest of us, we've now got an hour's break. And again, I urge you just to click on your link to the spoken presentations, the pre-recorded sessions, to listen from our amazing international presenters about some of the work that they've been doing across the world, advancing professional practice, influencing research, innovation. So please do click on there, and we'll see you back at 1:30 for our next session, our next panel session, and that is around global health. And the chair for that session is Dame Yvonne Moores. So we'll welcome you back. Have a great hour off, and we'll see you back at 1:30. Thank you.